and suddenly a scream from my neighbor's house. We rushed in, checking what was happening, just to find a grandma on the floor. We are all perplexed, didn't know what to do, scrambled around to get her to the nearest health facility. On getting there, the adults took care of the situation as usual, just for us seeing them coming back with disappointed looks on their faces and hearing the feedback that they don't have specialists on ground, so they cannot take care of her at that point in time. Now, we eventually left, went to another hospital, took one from the recommendations of friends and people around. Getting there, they were able to attend to her, they welcomed us, they had specialists. Unfortunately, we lost grandma, and we were being told that if we had happened to get there earlier or access medical care earlier, she would still be alive. Now, this is reality. And not just grandma got affected by that. A lot of people can relate to it. If it hasn't happened to you, it has happened to a colleague, a friend, just someone you know. And that is what brought about the birth of ER&I. Emergencies are unplanned. And in emergency situation, time is of an essence. But how do we know that where we're going to for the supposed care will be able to offer that to us? Please, my next slide. Our vision. So our solution is ER&I, which is a web application that connects users in emergency situation to hospitals that have the capability to attend to their condition. Next slide, please. Okay, our futures are two. Our tied healthcare center recommendation system and our hospital selection and alert system. So on getting to the web application, all you need to do is to tap the SOS button, and you immediately suggested hospitals that could give you the medical services you need. Now we have a feature where you could briefly describe what is happening, just using keywords, chest pain, diabetics, and with that we get to the app recommends healthcare systems to your facilities actually that have specialists in line with what you've put in the app on ground. So we give you that, and then you click on the healthcare facility of your choice, because we realize that as human beings, we have preference. On clicking on it, you get the hospital selected, get alerted that there is an incoming emergency patient, and then you get directed using Google Maps to the hospital selected. Next slide please. So this is what I've explained. You click on the SOS icon, you get the recommended healthcare center based on predefined criteria. So apart from what you impute as a user, we have put our own criteria to include best spaces and specialists. So it filters using that with information you give us and suggest healthcare centers to you. Next slide, please. Our monetization strategy. We plan to have private hospitals pay to use our app. We plan to cooperate, to partner with the government to get government hospitals on board to use our app also, and having organizations pay to advertise their products on our app. Next slide. Success metrics. So we estimated 160,000 users per annum. This is based on research that states that approximately 160 to 250,000 persons die annually in Nigeria due to lateness in accessing care in emergency situations. So getting 30% of that number, getting 10% of that number got us to the number 16,000 persons per annum for our app. Now for our revenue per annum, we plan, as the previous slide showed, we plan to get our revenue from by partnering with government, by getting private organizations to pay and running ad. So for each hospital or medical center that is enlisted on our app, they get to pay 10,000 monthly. So calculating it, there are approximately 40,000 healthcare systems in Nigeria, centers in Nigeria. So getting 30% of them on board and then multiplying it by 10,000 gives us 120 million naira. Then the other source of income is our paid advertisement. So we get organizations to pay our app to advertise their product. They will be charged $1,000 per month. So transitioning it to Nigerian money, we got and adding it to the income generated by getting healthcare centers to enlist on our app, we got a total sum of 136,545,000 naira. Now our retention rate is above average number of users annually. We didn't put a number to that, but we know that if this app helped you in an emergency situation, definitely you would want to use it again, though we do not plan for emergencies, but they occur. Next slide, please. Our roadmap. So as time goes on, we plan to improve on this particular web application. So we plan to stabilize our core features like hospital recommendation, alert system, and hospital dashboard. That one never ends. The next one is introduce appointment diary and reminder systems to improve users' engagement beyond emergency. The next is introduce ambulance request service. So you don't just get recommendations of hospital, you get to ask for an ambulance when you need it. The next is added feature that allows users to add basic health conditions. So you have a pre-recorded, if you have diabetes, you put it on the app before then. So by the time you click that SOS button, the hospital gets the information of not just the patient is coming, but the diabetic patient is coming. So they get to know things that they could prepare beforehand. Next slide, please. Our challenges include the challenges we could encounter include inaccurate and inconsistent hospital data updates, which we will address by working with the EHRs, that's the Emergency Health Resource Center, Okay, so they are the ones in charge of hospital data, and since it's an electronic thing, it helps us reduce inaccurate and inconsistent hospital data. The next one is system reliability under pressure. That's what we'll figure out as we go on. Next is low usage in case of emergency, as people may not remember the app in emergency situation, which is valuable. As time goes on, when it becomes a part of people, they will get used to it in the long run. Next is slow user adoption due to doubt of reliability of app. Now, when marketing, putting success stories help to get people on board and understand that this app actually works. Possible resistance from healthcare facilities to share data. We plan to partner with the Ministry of Health to get government hospitals enlisted on the app. Next one is high initial development costs. We plead for investors to come to our aid. Next slide, please. So here we just have an image of what our web application looks like. Next slide. Yes, and I would hand over the mic to my colleague to take us through the interface. Thank you.
Okay, we are very low in time, so quickly just rush through this. So actually, this is what the final version looks like. This is let's say design. So it's just the one we have currently doesn't look like this. What we have is a very small demo. So please. So just like you said. When you open the application, the first thing you do is, of course, we log in. And the reason why you log in is because in case where you want to come back again, you save you have your medical history saved, so for future purposes. So in case maybe, for example, you have something else again happen, you search. It's able to also recommend better hospitals for you, tally to your medical situation. So you log in. The next thing you see is a map. So once you see the map, you have there's a search bar where you can enter your situation or your emergency. Okay, you have maybe chest pain. So if you enter chest pain, to bring a cardiology for you. When you search it, it will list out the list of hospitals that are available. Okay, so that's the map. So you can see the search by service needed, you enter your service, and once you search for it, so please hit search hospitals. Okay, so when you move down, you see that here we have the list of hospitals that are available. Now, in case of, let's say, for example, you are satisfied for emergency for more than one person. So that means you need more than one bed. So you have inputs for how many beds you need. Of course, time goes on, the list will go so that you can make a better filter for yourself. So once you search for it, now the hospitals will be indicated with dots or another special icon. Once you click on the dots, because you might also want to find the name of the hospital you are going to. So all that means is just to click on that icon to display the information of that hospital you are going to, and also the time it takes to get there. So once you click on it, it automatically creates a route for you. And then when you get to hospital, the hospital takes care of the rest. So for the hospital management, the hospital. So as we have for the user, we also have for hospitals, because the hospitals need to know incoming emergencies, so they prepare for them. So when you click on that icon and you can create the routes for you, the hospitals that are registered with us will automatically be alerted. Emergency with such a person, this is what he has, and the hospital will basically make room for that service. It also gives him the time of arrival, so that because one issue that sometimes when we get to hospital, they have to start making documentation and all that. So our service will remove all that. They are sent to you first after you have been attended to. If there's anything else, then you can always sort it out. So under hospitals, hospitals also have the ability to add the service they have. So for example, let's say you have chest pain, but they do not have a cardiologist, so it will not be listed. And any service that is not listed under the hospital, the hospitals to appear to you as a user will only be the hospitals that have the service you need. So, for example, let's remove cardiology. Please save and go back to the user. You need to save the record. Yes. We'll go back to the user. So search for hospital again. No, just search. Searches. Okay, so if you go down, so you see we have just one. The other one was removed because that one does not have cardiology anytime. So that, of course, eventually the improvements will come in and we would improve it. So this is just a demo showing what's the outcome. Thank you very much.
Yeah, so thank you for that presentation. One question for me: why should I choose ERI over going to Google and just searching hospitals near me and clicking on that particular hospital and then going there to locate medication or treatments based on what I'm facing?
Okay.
When you use the Google option, you usually get all hospitals around you listed on Google suggested to you, and then you're forced to make the decision of which do I go to. Aside time, probably this is a dental clinic and it's coming first. The core aim of the ERI app is to save time in emergency situations, such that not only are you getting suggested list of hospitals or medical centers tailored to the particular emergency on ground, but you also get to alert the medical facility so they prepare ahead that we have an emergency coming, thereby reducing time wasted in accessing healthcare services during emergencies. Thank you.
Alright, so first, not question, suggestion. I think when you had to have ERI is too ambiguous. So maybe that was idea or something. I just think about it. I was just thinking about it. I remember ERI. But then the next question is, it's a product that is built for emergency situations. Now I'm concerned about the funding strategy, and when I say funding, or the payment strategy, so an emergency situation, who brokers that entire flow? That's, I have an emergency situation, so an accident, I get to the hospital, I expect that you alerted the hospital. Do I still go through that flow? Because the idea of alerting the hospital is to give me some sort of preferential treatment when I get to the hospital. Do I still go through the entire flow of having to pay, get a card, or is it tailored to what we do with HMOs where I get attended to first and then we fall back to the whole payment process? I want to understand how, I think that's something that might give the product a little bit of lead if the hospital is alerted and then I get there and treated first. So I think I want to just understand how that works.
Okay, so users do not pay to use the web application as of now. For emergency situations, it's totally free to every user. Now, when you get to the hospital, normally in emergency situations, when you get to the hospital with a patient, let me say you are accompanying the person, the hospital tries to stabilize that person while you go do the running around. That's how it's supposed to be. I don't know. That's what I know. That's what I know. So by the time they're stabilizing the person, you that accompany that person go do the running around and take care of the card, because we're not collecting anything from you. So the money, your payment has nothing to do with me. The core of the app is just to help you identify healthcare centers that you can go to that have the available services that you need at that point in time, and that's where the solution stops at now.
Thank you very much. I want to know, how do you mitigate a situation that is really not imaginable, because I'm feeling this kind of headache or head pain, and I just want to get it off right away. And I want them to attend to me immediately I get to the hospital, because that's one institute. So maybe if you've not looked at that, if I want to also. Thank you.
Okay, thank you very much, sir. There's so much you can do about that, but there will be a feedback option for the hospital. So if you're caught doing that twice, you'll literally be back from the app.
Interesting. I love this idea in the sense that it's tailored to a specific situation else. So that's a good plus to continue. I will push back and say hospital will not pay for this, but I'm willing to be proved wrong. Right? In Nigeria, hospital will not pay for this. And I think there's a lot of room to sort of improve this, because this is a very important problem space. Anyone living in Nigeria is an important problem space. So the response from this is how can we make this work for Nigeria? And I think the problem we should be solving is a logistics problem. Right? Not a machine problem. Yes. So that's what I'm suggesting for you. We should be solving the logistics problem. So I have an health emergency. I don't know about hospitals. I'm not a medical doctor. From the layman perspective, okay, probably I have an malaria. I don't know what hospital will treat malaria. Your platform should help you figure out all of that. What's the closest hospital, the hospital with specialization, etc. And then bring your medical to the hospital. You will solve that problem for Nigerians. Yeah. So it is a logistics problem, and if you can solve it with logistics subspace, solves the problem, I think you will get some traction, which is sort of the cash and carry, you get some traction, and then all of the headache, which users will begin on your platform, searching for the hospital, availability of doctors. Your operations team will be doing that, because while they're driving to the patient, they follow different hospitals, are you available, do you have a doctor, do you have the facilities, and if you get to the first hospital and you can't find what you're looking for, you're able to know the next closest hospital to go to. And this feedback is for all of the teams that are presented, not just for you. I see a lot of web-based solutions, software-based solutions, but one thing you'll realize building company in Nigeria, building tech solution in Nigeria is that you have to do a lot of thinking about your operations, because that's where the things break, right? You can just sit down and build an app over the weekend, but the operations is what is it now. And if you can tighten up the operations end to end, then you really in sport. So great presentation, and I want to see this work in reality.
So, one more thing for you and possibly for the entire people that have presented. I see a lot of persons trying to charge dollars, trying to charge dollars. Currently, they are always having issues, making payments abroad. And so, why complicate this issue by making our indigenous application, making us to pay in dollars, right? Like OPay came into the business and made things so sweet, and a lot of startups are making use of that. I don't want to go into those details, but let's really consider, because if that payment, if the process of getting the service breaks because I'm having payment issue, especially because of dollar and all that, it's not going to be able. Thank you very much.
All right, thank you very much, ladies and gentlemen. Put your hands together for Team ER&I. Because ER is standing on the response. Okay, thank you very much. All right, ladies and gentlemen, put your hands together for the 5 teams that have presented so far. All right, we started with Team EPMI, and they came up with a software solution that they call the Safety App. So when you are in an emergency situation and need to escalate the situation, they don't need to use any conventional means. They have designed a tech package for you. And then from there we move to identify who demonstrated or designed a software solution that helped for manage presentations. And we did a good one, pitching to us. And then we move to Agritech. Agritech's point of choice. Because we thought we have seen the best with the best two. But Agritech took it to a new level, and then when that's what I heard, we can leave the judges. They have made the competition even sweeter for us. And even when we thought we have seen it all, so they let the many to just come and let them go. They actually brought competition again. So the judges, they have great headache. I'm happy I'm not one of the judges. Who could do your something and come and tell us and we announce it. And if they have any reason to complain, we'll direct them to the judges. Anyway, let's start with Mr. Samuel. I want to appreciate you for coming. We will be inviting you and the other judges talking about peculiar Samuel again and Olumide, as well as some of the mentors. So listen to the category again: the judges, the mentors, the lead volunteer, and tech pastor, and the lead organizer, tech pastor. Please meet outside for a brief meeting. Judges, mentor, lead volunteer, faith, and lead organizer, tech pastor. Please meet outside. All right. Thank you. Ladies and gentlemen, we'd like to recognize the presence of Mr. Adebayo Lekon of the Prisons Fellowship Nigeria. Please put your hands together for him. Thank you very much, sir. You are highly welcome. God bless you. Okay, ladies and gentlemen, we still have one more speaker in the house. Olami Adewale is from Global Crafts. He's going to be sharing with us for the next 10 minutes. It's very unique ideas. Thank you, Mr. Alan.
Good afternoon, guys. My name is Mr. Olami Adewale Abdulafiz. I'm a CEO and founder of RoboCraft Africa. So we focus on robotics technology. And our focus is to catch them young. So let me just blow your mind. From next section now in Nigeria, robotics is part of our curriculum. So which means from GS1 is part of the curriculum we have to be doing. No doubt about it, robotics is already here in Nigeria and nobody can remove it from our syllabus. Now the question is, are we still in the stage of web, mobile, whatever? And the beauty of it is just like, if you are solving any problem on AI, you still find it difficult to solve problem on robotics because it has something to do with physical thing. So now this is an opportunity